Assalamualaikum warahmatullahi wabarakatuh. Good morning, ma'am, and all my friends. The Honorable Dr. Wisma Yunita, NPD, as supervisor, and all my friends. Ladies and gentlemen, on this occasion, I would like to present my journal. The title is Outcomes of the Novo and Acute Decompensated Hair Failure Patient According to Ejection Fraction. Before I present my journal, I want to introduce myself. My name is Peggy Melanti Adri. My age 18 years old and my gender is female. I am medical student of Bengkulu University. For the first time, let us discuss about the abstract of the journal. Abstract of the journal consists 5 items. One is background. There are conflicting results among previous studies regarding the prognosis of hair failure with preserved ejection fraction compared with hair failure with reduced ejection fraction. And number two is aims. The study aimed to compare the outcomes of patients with de novo acute hair failure or acute decompensated hair failure according to preserved ejection fraction and reduced ejection fraction, and to define the prognosis of patients with hair failure with mid-range ejection fraction. And number three is methods. Between March 2011 and February 2014, 5,625 consecutive patients with acute hair failure were recruited from 10 university hospitals. A total of 5,414, 96.2% patients with ejection fraction data were enrolled, which consisted of 2,867, 53% patients with de novo and 2,547, 47 with acute decompensated hair failure. And next is result. In de novo, all-cause death rates were non-significantly different between first ejection fraction and compared with hair failure with reduced ejection fraction. And number 5 is conclusion. The conclusion of abstract is preserved ejection fraction may indicate a better prognosis compared with reduced ejection fraction in acute decompensated hair failure, but not in de novo acute hair failure. And next, introduction of the journal. Introduction of the journal is prevalence of hair failure with preserved ejection fraction is increasing, and diagnosis preference ejection fraction is becoming for more of a challenge compared with hair failure with reduced ejection fraction. And next, methods of the journal. Method of the journal consists 5 items. The first is study population. This study used the registry of Korean acute hair failure, which is a multi-center prospective cohort study between March 2011 and February 2014. The registry prospectively enrolled 5,625 consecutive patients who were admitted for acute hair failure from 10 tertiary university hospitals. And next is data collection. Data collection. Detailed information on the study design the result of the Korean acute hair failure registry have been described previously. Briefly, all clinical manifestation, biochemical assay result, and medicational were documented at a first follow-up visit at 30 days and 3 months, 6 months, 1 to 5 years annually. And next, statistical analysis. We use the world's t-test to compare the difference of continuous variable between the two groups, which is broadly applicable without the need for an equivariance assumption. And next, the result of the journal. The result of the journal, the first is baseline characters. 1. Overall population. Among the population, 2,867, 53% patients had de novo acute hair failure, and 2,547, 47% patients had acute decompensated hair failure, acute decompensated hair failure. Compared with patients with de novo acute hair failure, those with acute decompensated hair failure were regionally high-risk patients. And next, preserve ejection fraction versus reduce ejection fraction. In de novo acute hair failure, there were 744 patients with preserved ejection fraction and 1,631 patients with reduced ejection fraction. Compare with present with versus reduced ejection fraction, those with preserved ejection fraction more likely to be older and female. And there was a higher prevalence of hypertension, pulmonary disease, and atrial fibrillation with lower prevalence of current smoking, alcohol consumption, diabetes mellitus, ischemic etiology, ICU, admission, and in-hospital mortality. And next is hair failure with mid-rank ejection fraction. Among the study population, a total of 875 60.2 present patients had hair failure with mid-rank ejection fraction, including 492 patients with de novo acute hair failure and 383 patients with acute decompensated hair failure. And next is clinical outcomes. Overall population. The median follow-up duration was 26, IQR 16 to 37 months. There was no significant difference in hospital mortality rate between de novo acute hair failure 3.9% and acute decompensated hair failure 40.8%. And next is overall population and hair failure with mid-rank ejection fraction. To determine the prognosis of patients with hair failure with mid-rank ejection fraction, according to the Novo acute hair failure or acute decompensated hair failure, acute decompensated, we perform Kaplan-Meier analysis started by ejection fraction rank in patients with de novo acute hair failure or acute decompensated hair failure. And next, subgroup analysis. The prognosis difference between preserved ejection fraction and reduced ejection fraction was consistent across the various subgroups without significant interaction in patients with both de novo hair failure and acute decompensated hair failure. And next, discussion. Discussion of this journal. In this study, we evaluated the clinical outcomes of prevalence ejection fraction, reduced ejection fraction, and mean rank ejection fraction according to acute hair fraction presentation using a prospective multi-center registry in Korea. Limitation. There were several limitations of this study. First, although the amount of missing data was minimized, 3.8% of the study population did not have echocardiographic data including. The second is we cannot discriminate between reverse ejection fraction and hair failure with improved ejection fraction due to lack of previous echocardiographic data corresponding to the initial diagnosis of hair failure in patients with acute decompensated hair failure. And three, the diagnosis of reverse ejection fraction in this study was made according to normal with seen in symptoms for hair failure which are often non-specific and do not discriminate well-being between hair failure and other clinical conditions. And next, conclusion of the journal. Among hospitalization of acute hair failure, preserved ejection fraction may be associated with a better prognosis compared with reduced ejection fraction in patients with acute decompensated heart failure, while preserved ejection fraction may share a similar prognosis to reduced ejection fraction, mid-range ejection fraction in patients with de novo acute heart failure. And thank you so much for your attention. Very sorry for all our mistakes. Might be useful. Good morning, Mom, and all my friends. Ladies and gentlemen, thank you so much. Assalamualaikum warahmatullahi wabarakatuh.